when it comes to an underwear question, for females, is it best to wear thongs, briefs, or no underwear? I heard you shouldn't wear thongs. Is that true? The potential dangers of wearing no underwear. A new STD or STI taking over New York City? Huh? Today, we are breaking down some of the most thought-provoking medical questions that you might be afraid to ask. Brace yourselves, this might take a walk on the wild side. All right, let's dive right in. First question, I just heard that they found an STD of ringworm in New York City. What in the new fear unlocked?
What?
Ringworm is a highly contagious fungus that occurs as a rash on your skin that transmitted skin-to-skin contact. Is this something really worrisome to worry about? No, it's not a new STD. It just occurs potentially during the act of sexual actions, but it's still skin-to-skin contact and still treated the same way. So ways to prevent this, obviously, if you have this, make sure you get treated. Try to avoid skin-to-skin contact if you're currently having a rash, right? Nobody wants to share their rashes if you know it.
Oh, just one free hand.
Okay, I'm just gonna keep moving here.
Does grip strength really help you live longer? Seems sus.
Squeeze me.
Grip strength is basically a way that you can kind of extrapolate and figure out what somebody's strength overall is, and it correlates to people living longer due to the fact that they have strength, muscle, versus does it actually exactly say that you're going to live longer? No. Some studies show a correlation of grip strength to a decreased overall risk of cardiovascular disease, mortality, and frailty. So if you want to increase your grip strength, there are a couple things that you can do. Really, the simplest thing is pick up something heavy and hold it in your hands. Obviously, do resistance training and heavy workouts. Number 3, when it comes to an underwear question, for females, is it best to wear thongs, briefs, or no underwear? I heard you shouldn't wear thongs. Is that true?
Well, at least they're wearing clean underwear.
So the choice between a thong, brief, nothing is a very personal choice, but there are things to be aware of and to avoid. The biggest thing is you don't want to increase the risk of UTIs or yeast infections because, say, your underwear is so tight that it doesn't allow air circulation and breathing, and then it harbors the growth of bacteria and fungus. Hey, if you don't want to wear anything, that is fine as long as it's quite hygienic, it gets good airflow. But again, just be making sure that you change your clothes often enough that you're not increasing the risk that you're getting an infection yourself. Number 4, one of my favorite snacks has been tortilla chips and salsa for the past few years. I've had to enjoy this less and less because the salsa has been giving me an upset stomach. Why is this so?
Time to make some salsa.
Good question, but salsa could be acidic, spicy, and it could change the acid environment of our stomach, increasing the likelihood of irritation, increases the risk of acid reflux. If you notice that the salsa is causing issues, you can try to change the different types of salsas, maybe not as spicy, or finding some that might not be as acidic because you're using different types of ingredients, but tomatoes could cause irritation to people's lining of their esophagus and their stomach. Next question, why do I feel heat on random parts of my body for no reason? So a good question.
I feel really warm when I am around you.
So feeling heat in random parts of your body has multiple different reasons why. It could be related to infection, could be related to nerves, could be related to hormones. Allergic reactions can cause heat in certain areas of the body. So just something to be aware of. If this is something that continues to be persistent, it needs to be evaluated by your healthcare provider. Is getting hit by a lightning bolt like losing the subscription for life? Like, does the electricity shut down your organs? And if not, does it make your whole body crisp like KFC chicken? So great question. Yes, a big jolt of lightning can cause you to go into immediate cardiac arrest, stop your heart. Could cause you to go into cardiac arrhythmias, meaning your heart going into an abnormal beat, which may or may not be sustainable with life, in the sense of it could also fry your nerves on the inside. Do you typically see somebody who have fried skin? No, there is typically a pattern on somebody's skin when they do get struck by lightning. Next question, if you're feeling weak and sick, should you try to be active or rest?
I'm sick.
A very good question. Sometimes people are like, oh, I'm sick, let me sweat it out. So typically the best thing that you can do is rest. Give your body a break so that it can use all of its force and strength. Hydration first, rest, get lots of sleep. Also, there are supplements out there that you can take like elderberry, vitamin C, and my go-to for having like a good night's sleep when I'm well, or even if I'm not feeling well, is definitely this. It's Do Not Disturb by Life Happens. It's got magnesium, passion flower, L-theanine. It's gonna help you get a restful night of sleep. That way you can take on the day the next day. If you're interested, check it out, lifehappens.com, and it's also on Amazon. Hello, what happens if a person has fatal familial insomnia, is given sleep pills, or put into a coma or under anesthesia? So what is fatal familial insomnia? Basically, it's a disease process that's progressive relating to a rare prion deposits disease in the brain, which is affecting the sleep. So then the question ends up being, can you give these individuals sleeping pills to help them go to sleep? And typically it does not work. And then could you put somebody in a coma to have them sleep, or to give them medication to sleep? Yes, you could, but it wouldn't necessarily help the situation because there's no cure for this, and it is a progressive disease that continues to get worse and worse. I am thinking of getting circumcised. What are the pros and cons of getting it done older?
Meaning we're going to circumcise him. They are gonna cut off his fireman.
It's Jewish tradition, Bubby.
Normally we do it right after the baby is born, but we had to do it later for Ike because he's a...
So the pros of getting it done when you're older obviously has to do with hygiene. Okay, hygiene is one of them, to reduce infections, reduce the spread of disease, reduce the potential chances of sexually transmitted infections. And then there's a very, very low risk of cancer to begin with, but then you would reduce your risk of cancer as well. So the cons of having it done when you're a little bit older relate to the pain of the surgery, so it hurts a lot more, or the perception of the pain is the heel, the risk of infection because of the surgery. There are some cons to it, so you do have to weigh the pros and the cons relating to getting a circumcision at an older age. Next question, number 10. Why do they tell us to change our toothbrushes every few months? Is it true the tongue has different bacteria than your teeth, and you shouldn't use your toothbrush on your tongue? So it is a good rule of thumb to replace your toothbrush every 3 to 4 months to maintain its effectiveness as well as the hygienic nature of it. So yes, our mouths have lots of bacteria in it. Now, could you scrape or clean your tongue with a toothbrush? Yes. It's not specifically designed for that. There are tongue scrapers out there that are specifically designed to scrape the tongue. What is the most painful pain that a person could experience? I saw my dad have kidney stones. Seemed pretty terrible.
Kidney stones.
If it was something else.
Well, that would be kidney stones.
So yes, kidney stones are indeed quite excruciating when it comes to pain. Other types of pains are childbirth, cluster headaches, shingles because it's a type of nerve pain. And then there's also something called complex regional pain syndrome. And there's a lot of other things out there that can cause extreme amounts of pain. What's the most painful thing that you've ever experienced? Let me know in the comments. What are some of the best non-workout type of things to do to extend your life? Good question. I would say please work out. So good sleep habits. Make sure you're getting the appropriate amount of sleep for you, 7-8 hours of sleep. Healthy diets, right? So you want good, healthy food and not overeating. You want a good energy balance. Obviously staying away from things that are not good for you, like smoking.
Because smoking can lead to all kinds of health problems like cancer.
Or excess drinking of alcohol, or illegal substances that wreak havoc on our bodies. Can I swim in the ocean with a surface wound? So obviously swimming in water in general with an open wound typically is not advisable, and it's because it inhibits the wound healing, basically keeps the wound open. Open wounds have an increased risk of getting infections, right? And so big things in the ocean that you worry about is a species called Vibrio, which can cause infections of the skin. And avoid the ocean water, avoid immersion wounds in water in general. What's better for you, Tylenol or Advil for a headache? Is one bad for you? Sorry, I don't know their scientific names. So Tylenol is acetaminophen. In other parts of the world, paracetamol is a very common name for it. And then Advil is ibuprofen. Tylenol in itself is an antipyretic, so it reduces fevers, and a pain reliever, but it is not an anti-inflammatory. Versus ibuprofen is a fever reducer, pain reliever, as well as an anti-inflammatory medication. So if somebody's having a headache, you can use either. Sometimes some people will use both, which is fine. But please obviously follow the recommended dose on the over-the-counter bottles as well as what your doctor has prescribed. All right, last question. Quicksand, can it kill you? It was my biggest fear as a kid, but I've truly never seen it in my life. Quicksand is a mixture of sand, clay, and water. And the movies definitely depict that you're gonna like sink in so deeply and be covered and basically like suffocate and drown. But in reality, it is unlikely. Could you sink into it? Yes, you could sink into it to your knees, to your waist, even to your chest. But most people have issues and injuries or even death relating to quicksand. It has to do with, the struggle, being in this type of mixture for a very long time and can't get out. Dehydration, hypothermia. These are the things that you worry about. So great questions, everybody. I appreciate it. Keep them coming. Send them my way. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything so you can get super educated. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.